I think that when you can access healthcare, you get excellent care in Canada. We are highly trained physicians, nurses, and medical teams. The difficulty is, according to Stats Canada, I believe about a third or 30% of Canadians can't access care of all sorts. And in my practice, I see this all the time, particularly for people living in rural areas who don't have access to a family physician, and the access to any specialist care is even more difficult for them.
So the 90-day waiting period for MAID for people with chronic illness, chronic disabilities, and mental illness is actually shorter than what the average waiting list is to get into a specialist or to see a psychiatrist. Accessing mental health specialty services in my area is a minimum 3 to 6 months. This is the same for people with chronic illness or disability. Often waiting to see specialists anywhere from 3 to 4 months to sometimes over a year for specialized fields.
Palliative care has come to mean the care for people who are in difficult circumstances at the end of life. Quite a number of years ago, the government did a study, and they determined in their study that it was about 30% of the population that had access to proper palliative care. And I'm not sure that it has really risen much above that now.
The problem is that so few Canadians have access to good palliative care. In the area where I live, we have a hospice with 8 beds. I have applied for several patients to go there, and none have actually made it because 8 beds for an area of almost 1 million people it's like winning a lottery to get access.
I'm quite concerned that because people cannot access a service, whether it's a talk therapy service or whether it's a medicine-based service where they're receiving a medical treatment for their mental health condition, that increasingly people will grow hopeless and discouraged, and because they're not receiving any help as they're suffering with their condition, we have the potential to see more and more people reaching out for MAID as a solution, or as the way that they're going to address the suffering. And I don't think that's right.
But there are definitely gaps in the care. I can tell you this partially because one of the things that I do when I'm on call for palliative care, home care, is that we are the recipients of calls from physicians all around the province. And there are many places in the rural part of our province and in other rural parts of the province where palliative care is not available. And we are trying to support the family doctors who are there into giving the best care possible. But they don't have visiting home nurses, they don't have all the other support things that they would need to provide quality palliative care. And even in their small regional hospital, they may have no one who has extra training in palliative care. Despite the fact that people could get MAID any place they want to, and the government will pay someone travel expenses to go to do that, they don't do that for palliative care. And I think that's a real disservice and a real human rights violation.
I think we'd be doing a better job for Canadians as a medical community if we were focusing our efforts on trying to address some of these human resources issues, trying to bring care to people who have difficulties accessing care, and for getting creative in developing new ways of administering care.
People who don't have the resources for basic necessities of life because of their illness, because of their disability, are feeling cornered. They're feeling pressured to choose MAID as an option out of their situation, and that's wrong. We as a society can help provide those resources so that they can live and not have death as the only alternative option for their situation.